Here are the core ethical principles for ABA. First is to do no harm. Second is to respect autonomy or independence. Third is benefiting others. Fourth is being just. 5 is being faithful. 6 is to treat clients with dignity. 7 is to treat others with caring and compassion. 8 is the pursuit of excellence. And 9 is accepting responsibilities. These are the core ethical principles of ABA. Try to learn these. As an RBT, this is what you'll be doing. All the procedures that you're going to be implementing, all the interventions, should do no harm to that individual, respect that individual's autonomy and teach them how to be more independent, should benefit the individual in some way. Okay, it's going to be just for that person, fair. You need to be faithful to and truthful to the patient and the patient's family. You need to treat the patient with dignity. You need to treat others, including the patient, with caring and compassion. You should pursue excellence. Okay, learn about the principles that you're using, and if something goes wrong, you should be willing to accept that responsibility. So, what does do no harm mean? Okay, the behavioral analyst sets out to improve the lives of others, and almost all would not harm the person, on purpose. But what you want to look out for is that unintended harm, such as practicing outside of your professional boundary. Working with a person you may not be familiar with as far as their, maybe it's their behaviors you're not familiar with, maybe it's a diagnosis, whatnot, okay? Because you may do something, if you're not used to working with a certain population, that actually makes a problem worse, okay? Then you'd be harming that person in that way. So when we're talking about do no harm, we're really talking about, that kind of smaller unintentional thing that we may be doing. I mean, obviously it also covers the purposefully harming people, but like I said, most people are not going to do that, when we're working in this field. But it's very easy to kind of drift into a place where you may do some unintended harm, such as working outside of what you know how to do, or not explaining the procedure well enough. For example, one time I remember when I was working with a family, and I told them, "Hey, we can try this," and I didn't explain it well enough that we were going to try that when intervention actually started, and they started immediately. And of course, I hadn't trained them well enough yet because it was just our first visit, and they started doing this procedure that they thought I'd asked them to do, and essentially they made the behavior worse that week. And again, that was my fault. I didn't fully explain to them that, hey, I didn't mean to start now. I meant that we'll start that eventually. So I was able to, and then we'll talk about taking responsibility at the end of this. But the point was that I unintendedly harmed that child because the parent started this intervention they didn't know how to do, and it actually made the behavior worse. Okay. So another thing that you can also, that is kind of a subtle way of doing harm is to not have a good data collection system that shows the actual severity of the behavior, because you want to capture what's really going on. For example, if I had just, let's say, a frequency count of something, and I looked at the frequency count and, this person's only done this behavior 5 times a day, it's not really that big of a deal. But what if in those 5 times it was really severe and it really, caused a lot of harm? Okay, so because my data system wasn't good enough or didn't reflect the severity of the behavior, I kind of could unintentionally lead to harm for that person. So the point is that we strive to identify, as a behavior analyst, I strive to identify things that could harm the patient in an unintended way, and do things that are going to prevent that. Because again, one of these core ethical principles is to do no harm. As behavior analysts and as RBT, we're going to respect the patient's autonomy or their independence. We're going to promote the individual's autonomy and independence. We're going to help them to gain this and plan for issues that come with being more independent. For example, I wouldn't just teach a person to ride a bus, but we're also going to have to teach them how to read a map. If we're going to teach a person how to use a microwave, we also need to teach them what not to put in the microwave. We need to teach them don't put silverware in there. Because as people gain independence, as people gain skills to make themselves more autonomous, they're also putting themselves maybe in more harm's way, right? Because if I teach a person how to walk around outside, or walk across the street, we also need to teach them how to safely walk across the street. It's not just enough to teach them how to walk across the street, but we also have to teach them how to look for cars, how to look for obstructions and stuff like that. Okay, so in this idea of respecting autonomy and independence, we have to prepare for that. We have to say, hey, this person may come into contact with more possible, things that could harm them because they are being more independent. Think about the child who learns how to walk at a young age. Okay, if they're learning to walk, suddenly when they're walking, they have to, if they don't know how to avoid things, they hit their head. Okay, it's kind of the same idea. So, in the idea of respecting autonomy or independence, one of these core ethical principles, we do want to promote the individual's autonomy and independence, but we also want to help them to gain, and plan for issues that come from being more independent. Okay. Another core ethical principle is that ABA benefits others. Okay, the behavior analyst seeks out to benefit others in various situations where they may find themselves. And although this may seem odd, it is important to know who the patient actually is, client is. Okay, I'd say that because I found myself in several situations where I was trying to appease not the patient, really, not trying to work with the patient, but trying to appease like the teacher or the speech therapist, trying to, give them to, what's the right way to put this? Just basically trying to fit the intervention into what they wanted rather than what may have been best for the patient. And so as I got a little more experience, I started to understand, hey, look, I'm here for this person. And irregardless of what else is going on, I'm here and working with this person. So it is very important to identify who that patient actually is when we're talking about benefiting others. Okay, yes, we're going to benefit others in roundabout ways, but the idea is that when we're talking about the benefit for the patient, okay, we need to make sure that we know who they are. Being just, okay. In very general terms, this means that we're going to treat others as you would want to be treated. Okay, golden rule, right? Or you might ask yourself, how would you want a loved one to be treated in this circumstance? Okay, would you want them to be, loved for, cared for in a way that instead of being punished all the time, would you want them to be reinforced? Essentially, being just just means that we're going to treat others in the same way that we would want to be treated. Or how you might want a loved one to be treated. So, for example, if I didn't know my way around a city and I went up to a person to ask for directions, okay, and they were mean about it or angry about it, that wouldn't be right. I wouldn't think that was very just because I wouldn't want to treat others that way. Okay, so when we're working with other individuals, when we're working with our patients, sometimes you have to stop and think. Some of these patients don't know how to talk, or they don't know how to get their needs met, or they need a different way to get that need met. How would you want to be treated in that situation? Would you want to be treated with impatience, being yelled at, being punished, or would you want to be treated with, care and dignity and patience, so that person can actually, wait and learn what you're trying to ask? So again, it's very important. This is a very important principle. Being faithful. Okay, we strive to be honest and trustworthy. We follow through with our statements. Again, remember, we're seeking to develop a good reputation, not only for yourself, but for the field of applied behavior analysis. Something I've learned over time is that all your actions are being watched. That's kind of creepy, right? But how you, present yourself, how you are essentially dealing with others, people are going to pick up on that, even the little things. Okay, so when you're professionally engaged, strive to be honest and trustworthy. Okay, follow through with what you say. Make your word mean something. All this over time will develop a good reputation. We need to treat our clients with dignity. Remember, your patients deserve respect. This means providing them choices, treating them well, etc., etc. Okay, some of these individuals, yes, can be challenging at times, but all of our patients deserve dignity. They deserve respect. Okay, so this is a very important idea. Okay, even if that person has gotten under your skin, or you're upset, or having a bad day, you still need to treat them well. You still need to provide them choices. Hey, do you want to do this or that? Okay. We need to treat others with caring and compassion. Be compassionate to the situation. Provide sympathy. Remember, treat the patient well. I know it kind of goes without saying, but it can be sometimes on the end of a hard day, it can be easy to forget that, hey, this is a person that we're working with. This is someone who has feelings. This is someone who has an individual life. It's not just something just a person you clock in and clock out and work with. Okay, this is a natural person. And we need to treat them with caring, with compassion. Even if they're not showing you that same way, remember, you are the professional. It's a very important thing to understand, and something that over time you'll develop. The pursuit of excellence. Okay, one of the core ethical principles. We want to stay up to date with the most current research. As a behavior analyst, this means I'm being part of an ABA organization, signed up, for a regional organization, so I can learn more about what's going on. It's my responsibility to do that, to stay up with the most current research. Because remember, this technology of ABA is always changing. There's a research journal where people are trying different types of new interventions, and it's my responsibility to keep up with that. This is a very important thing. Okay, I need to make sure I'm providing my patients with the best kind of treatment. And finally, we have accepting responsibility. Okay, when something doesn't go right, the behavior analyst will strive to accept responsibility and modify whatever it was that went wrong to make it more effective. Okay, the thing I've learned over the years is that you can't assume anything. Okay, even if it makes sense to you. Well, let me give you an example. If you implement like an intervention, you give the parent an intervention. One of the things that a lot of people get annoyed about behavior analysts is that we write everything out. We will do a task analysis and write every single little thing out. The reason we do that, though, is we want to make sure it's covered. Because there's been situations where, I assumed that the person implementing the intervention would understand how to, pick out effective reinforcers or effective items for reinforcement. So I might say something like, we'll give an item once the task is complete. That's too general. Okay, I need to say would give a reinforcing item or an item that the person actually wants to work for. Okay, but if the plan isn't going to as planned, if it's not working, I need to take responsibility for that. Okay, it's my responsibility because I didn't effectively communicate it. And at the end of the day, I have to take responsibility for that. Okay, and I need to modify whatever it is to make it more effective, whether I need to write it out better or whatever. Okay, the point is that if something doesn't go right, it's my responsibility. Okay, and that's something that can be a difficult thing for some people to understand, but it's just something that is true, that as a behavior analyst, I'm going to strive to accept responsibility, and I'm going to modify whatever is going wrong to make it more effective.